Hello and welcome to Olympic Community of Health's Equity Presentation. I'm Miranda Berker, OCH Staff and Program Manager. I want to thank you for tuning into this recording today. This is a presentation that was presented to the Olympic Community of Health Board of Directors and additional partners on October 12th. We are intentionally inviting a wider audience and recording the presentation so that you are welcome to share this more broadly with additional staff as you think are interested. Today's recording will be approximately 45 minutes or so. The actual presentation will be approximately 90 minutes, but for the sake of the recording, we will shorten some of the breakout sessions and invite you to just pause yourself as we approach those activities and do them on your own time. Before we dive into any content, Olympic Community of Health would like to acknowledge that we're on the territorial lands of the Coast Salish, Clallam, and Chimicum tribes. That's where the Port Hapak office is located. It's also important to celebrate and acknowledge that October 12th is Indigenous Peoples Day. Indigenous Peoples Day is a holiday celebrated on the second Monday of October in the United States in lieu of Columbus Day. Indigenous Peoples Day at its core aims to celebrate and honor the past, present, and futures of Native peoples throughout the United States and acknowledges the legacy of colonialism, which has devastated Indigenous communities historically and continues to negatively impact them today. More importantly, Indigenous Peoples Day moves beyond the narrative of oppression and honors the histories, cultures, contributions, and resilience of contemporary Native peoples. Celebrating Indigenous Peoples Day in lieu of Columbus Day is a step forward towards undoing a legacy of bias and discrimination facing Native peoples. With that, I'm going to go ahead and pass the mic over to Vicki Lowe, Executive Director of the American Indian Health Commission for Washington State.
Thank you, Miranda, and thank you for having me here today. Aiskachi Vicki Lowe, Nastatitlam Nuskalayam. My name is Vicki Lowe. Well, actually, good afternoon. My name is Vicki Lowe. I'm Jamestown Sklallam. I'm also Bella Coola First Nations from Canada, but I has spent my life here, and you know, my culture comes from what I've learned from the Jamestown tribe. In my mind, I think it's really appropriate for you to be having this training on today, formerly known as Columbus Day, a day I used to go to work and wonder why I couldn't get any mail or go to the bank. So by celebrating Indigenous Peoples Day, we are really beginning to tell the truth about our history. And history plays such an important role in how we are today, who we are, and how we live together. History really needs to be understood in order for us to make life better for all. People often confuse equality and equity, and just to simply put it, equality is when everyone has access to the same thing, and equity is when each person has access to what they need for themselves. I just want to offer some food for thought before you begin your training. When explorers and settlers originally came to this country, they discovered land that was already inhabited by people who were very different from them. Also not very different. These Indigenous people had their own language and culture and governments and food systems and values. From the very beginning, the relationship has really been about assimilation to the values of the newcomers. Some would say this is how the world worked back then, the dominant people conquering those who they came into contact with. But this concept is still pervasive in everything we do. I just want to offer a glimpse into my world, the world where I exist, in a world where the dominant values are not my values. In 1996, I went to work for my tribe, and I felt at home for the first time in a workplace. I realized that I had the same values and even the same sense of humor as the people I was working with, and it felt really good. And I feel like it really helped me do my job well, right, Brent? He's not, yeah. But in the I see you, he's doing math. But in the past 5 years, I've really had to like push myself outside of that world and meet and, you know, do presentations with the ACHs, a lot of state agencies. And I came to a realization about meeting with these, what we call non-tribal partners. And it's really been a huge adjustment, you know, going from working with tribal people who share my values to kind of the outside world where people have different values, and it's not wrong to have different values. It's not, you know, no set of values is right or wrong. It's just different. But when I go to those meetings, sometimes it takes me a couple days to recover from the different values. So really what I wanted to offer here is to, just as you go through this training and learn about race and equity, and, you know, many of you know some of that because of the work that you already do. But from my perspective, I would hope that one of the things that you get out of it, and as you move forward, is when you meet people and you are in meetings, that you maybe think about what the world might look like from their values and their perspective, and come to a way of being able to honor not just your own values and when you're working with other people, but maybe to be open-minded enough to understand what their values are and to help incorporate those into the work that you're doing, because I think that is a way that we can get to equity. So as I like to say, acceptance is the opposite of oppression. So if we can learn to accept other people's beliefs and values, then that is how we can truly get to equity. So that was all I wanted to share, and I really thank you for inviting me and letting me speak. Thank you.
Thank you so much for being here today, Vicki, and for being willing to share some of your insights and thoughts. We really appreciate it. Many of you are already familiar with Olympic Community of Health's vision, purpose, and mission. Today, in the presentation, we're going to focus on a component of the vision, which is equity. Together, in our time together today, we will review some shared language around equity, discuss some principles and strategies, and discuss the strengths as well as the challenges in the Olympic region's equity work so far. We will also explore opportunities for where we can and would like to do better moving forward. So you might be asking yourself, why equity, why now? On Indigenous Peoples Day, one thing we can do to take action is to reflect and learn more about equity. We are seeing conversations around race, social justice, and equity occurring across the nation and within our own local communities. Olympic Community of Health staff over the past 2 years have completed 2 equity trainings and developed an equity action plan to further this work. And a part of the implementation plan for Olympic Community of Health is to complete a strengths and gaps analysis of equity in the Medicaid Transformation Project activities. I think it's really important to note that we think of today as just a starting place, so this training is not going to be completely comprehensive of all things that equity entails. Also, I'd like to note that I do not consider myself an expert in this area. Rather, I've had the opportunity over the past 9 months to improve my own growth and learning in this area, and I appreciate the opportunity to step into this courageous space with you today. We've heard a need from partners to dive deeper into equity, and as we look ahead to what the future work of Olympic Community of Health could be, it'll be helpful to understand the current status. So today is an opportunity for peer learning and sharing, and to look at the work and opportunities of the collective Olympic region. Like I mentioned, equity is a huge topic to tackle, and we obviously won't be able to cover everything that equity entails during our time together today. Rather, today we will focus on just a few components of equity, and we can explore opportunities for future learning later on. Right now in the media, we're hearing a lot about equity as it pertains to race, and there are many areas where we can look at equity. Some examples are shown here. In our region, we often hear about equity in terms of geography, particularly being a rural region, and the inequities that can bring with transportation, internet access, etc. Today, we're going to take a step back from any one content area and instead focus on some equity fundamentals and some discussion around where there may be opportunities for the region to take action. As you embark on this journey with us, these are some shared agreements for today. Our goal is to create an atmosphere of learning, reflection, and commitment. So I'd invite you to just take a moment here, review this list of shared agreements, and make sure that these are things that you're able to commit to doing in the space that you're watching this recording today. I also want to acknowledge that some of today's content may be challenging. Equity and anti-racism discussions are prevalent today, and many people are experiencing feelings of despair and anxiety. And we also know that these are not new feelings or experiences for communities and people who are adversely impacted. So I encourage you to take care of yourself and invite you to participate to the fullest capacity that you're capable today. Before we get started, I'd invite you to pull out a piece of paper and a pen. You can go ahead and pause the recording if you need a second to collect those items. And write down your answer to the prompt on the screen. And you can feel free to have more than one. This is an activity from Brene Brown's book, Dare to Lead, where you just can ask yourself before we dive into content, what do you need to give yourself permission to do, feel, or not do to show up for this training today? So some examples might be, I give myself permission to check on my kids if I need to, if you're working from home with little ones. Or maybe I give myself permission to stand up and move during the presentation. I give myself permission to turn off my email so I can stay focused. And maybe you might have one that involves something around, I give myself permission to pause this recording and come back and visit it at a later time if I need to. So go ahead and pause here and take a few minutes to write down what you feel like you need. So I'm going to start us off with a video, and I'll invite you to just observe. And I'll have you ask yourself, do you see the dancer spinning clockwise or counterclockwise? So now I invite you to close your eyes for a moment. And when you're ready, open them back up and try and see if you can observe the dancer spinning in the opposite direction. So if you saw her spinning clockwise, when you reopen your eyes, can you shift your perspective to try and see her spinning in the opposite direction? And maybe you were successful at that, and maybe that was more challenging, but I'll invite you to again, go ahead and close your eyes. And then when you're ready, open them and see if you can get her to switch back again. So if you were able to switch the direction, are you able to flip it back and observe her spinning the original way you first saw? So some of you may have been successful at getting her to change direction, and some of you may have been stuck. But so it doesn't bother you throughout the rest of our time today, and in case you don't believe me, It is possible to see her spinning in both directions. And this video kind of helps highlight that. So on the far left-hand side over here, she's spinning clockwise, and over here, she's spinning counterclockwise. And here in the middle, you can see this is the original. And maybe with these images, as you flip between the left and the right, you might be able to see this middle dancer spinning in both directions. So switching perspectives is hard. We each are coming today with our own experiences, privileges, beliefs, and biases, which impact the way we see, hear, interpret, and interact with the world. So today I invite you to try switching up your perspective, especially as you encounter information that is new or challenging. We're all on this journey together, and the more open-minded we can be, the more open we are to learning and growth. So the first activity that we're going to do is just try to get to some shared language. So this activity might feel a little bit vulnerable. Hopefully, if you're watching this recording, maybe a little less so, because you'll be doing it on your own. But it's important to remember that there's no wrong answers here. So this isn't an activity about getting it right or wrong, but just about to kind of test your own knowledge base and comfortability with some of these terms. So at this point, I'd invite you to go ahead and pause the recording for about 7 to 10 minutes or so, and try and come up with your own definitions to the following. Again, this isn't about being right or wrong, so really try to fight the urge to open up Google on your desktop and look up the definitions, or to flip ahead in the materials to there is a handout with the definitions on here. But again, that's not the point of this activity, so I invite you to just test your own knowledge base and go ahead and pause the video here. When you're ready to come back to the recording after you've taken some time to reflect on these definitions, go ahead and ask yourself, were any of the definitions particularly easy or challenging to come up with? And if so, why do you think that is? Stored in the materials along with this recording is a one-pager with definitions of all of these if you would like to review that. Next, we're going to watch a short video that just talks about the difference between equity and equality.
These days, we hear a lot of people using the word equity, but what does it really mean? It's not quite the same as equality, which means everybody gets treated the same. Equity is about fairness. It means that everybody gets what they need based on their own situation, because we're not all the same. The difference between equality and equity is important. It's part of the reason the United States spends more on healthcare per person than any other advanced nation and has much poorer health. It's important to remember that a person's health depends on many factors, things like their environment, schools, and workplaces, to name a few. We call these social determinants of health, like clean drinking water for children and easy access to fresh food. We can follow the lead of communities like Columbia Gorge in Washington and Oregon, where businesses, doctors, and farmers tackled the local hunger problem with the Veggie RX voucher program. And the New Jersey Partnership for Healthy Kids is bringing down high rates of obesity in underserved communities. We should be inspired by these local efforts and remember that health equity is all about making things better for all of us. When everyone's healthy, everyone benefits.
So I'd invite you to ask yourself here, what are some examples of where you see equality in action? And the flip side of that being, where do you see examples of equity in action? And just see if you can come up with a couple of examples. And if you can, local examples might be more helpful within your own organization or in partnerships that you see. And if that's challenging, then maybe think on a more nationwide or global scale of where you might see some examples of equality work in action and equity work in action.
These
So we've talked a little bit about the difference between equity and equality. It's also important to talk about the differences between equity and parity. So you might often hear people talk about equity as closing the gaps or bringing everybody up to the same level. But we know that parity is really the opposite of disparity, and disparity is the differences in status between people related to social or demographic factors such as race, gender, income, or geographic region. Disparity derives from the Latin term dispar, or unequal, and the opposite of disparity, like I mentioned, is parity, which is the condition of being equal or the same. So, for example, racial disparities are not simply a matter of individual choice and behavior. They're a product of a complex and often invisible history that has limited options and opportunities based on race. So, many forms of racism, both past and present, shape who benefits from economic opportunity. We know that low disparity is not always a good thing. So, you might hear people conflate, oh, well, there's not a lot of disparities between groups, so that means that people are equitable. But closing the gap or having limited disparity usually means bringing everyone else up to the quote-unquote white standard. And this white standard can also mask inequities within white communities. The white standard doesn't mean that all white people are meeting that standard. And there are opportunities to address inequities within white communities as well. Next, we're going to review a few equity principles. There are more, and these are available in the materials section that accompany this recording. I'm going to review just a handful for purposes of our learning today. An important aspect of having equity literacy is its insistence on maximizing the integrity of transformative equity practice. So it's important to avoid being lulled by popular diversity approaches and frameworks that really don't pose a threat to inequity. And they're sometimes popular because they don't pose a threat to inequities. The basic principles of equity literacy can help us ensure we keep a commitment to equity at the center of our equity work and the broader equity conversation. So like I mentioned, I'm just going to pull a few today. There's a more comprehensive list available in the materials. The first one I'm going to talk about is direct confrontation. So direct confrontation is the idea that there is no path to equity that does not involve a direct confrontation with inequity. There is no path to racial equity that does not involve a direct confrontation with interpersonal, institutional, and structural racism. Equity approaches that fail to directly confront inequities actually end up playing a significant role in sustaining inequities in the long run. The next principle is power and privilege. So inequities are primarily power and privilege problems, not primarily cultural problems. Equity requires power and privilege solutions, not just cultural solutions. So frameworks that attend to diversity purely in vague cultural terms like, quote unquote, the culture of poverty, are not really a threat to inequities. The next principle is systems, not people. So for example, educational outcome disparities are not the result of deficiencies in marginalized communities, cultures, mindsets, or a product of, quote unquote, grittiness, but rather of inequities. So equity initiatives focus not on fixing marginalized people, but on fixing the conditions that end up marginalizing those people. The last I'm going to mention here in our learning session today would be the one size fits few, or you might have an image in your head of like the peanut butter spread approach. We know that no individual identity group shares a single mindset, value system, learning style, or communication style, everybody watching this presentation will have a different mindset, will have a different value system, will have a different learning style. Even though some of those things may be similar across some people, none of those things are going to be the same across everybody. So identity-specific equity frameworks like group-level learning styles almost always are based on simplicity and stereotypes rather than on equity. These principles of equity are adapted from the Equity Literacy Institute, and that's where the comprehensive list that's available in the materials comes from. So what does it look like to actually put equity into action? It can look like a lot of different things. There's a lot of ways to approach this work. It can look like advocating for policies that promote equity, systemic changes that remove barriers. It can look like taking coordinated action to address the determinants of health. It can be civic advocacy and engagement. It can be choosing to adapt and adopt an equity lens for your internal organization. It can look like meaningfully engaging the community. It can be actively supporting historically marginalized and distinct groups within racial and ethnic categories. And equity in action almost always involves utilizing a positive asset-based approach. So some examples here locally in our Olympic region of equity in action would be Olympic Area Agency on Aging's work on becoming a trauma-informed organization. O3A sets a strong example of what it looks like to prioritize community health by integrating trauma-informed care into every department, actively seeking staff involvement in the path forward, and working towards concrete goals. Peninsula Community Health Services has expanded their community health worker program. Community health workers are impacting the lives of many by using unique experiences, skills, and partnerships to prioritize population health and approach outreach through a lens of compassion and empathy. The Olympic Community of Health Board of Directors, from the beginning, rather than treating the tribes, the 7 sovereign nation tribes as a sector, the board encouraged all 7 sovereign nations in the region to participate to the extent that they would like to, and recognize the need for each tribe to be allotted a seat and vote, rather than be lumped into a quote-unquote sector. Clallam County Health and Human Services used their Olympic Community of Health COVID-19 response funds to bring free testing to populations of uninsured, underinsured, and undocumented communities. Building trust with the migrant worker community is especially important as the Health and Human Services works to engage this community in other programs such as WIC and immunizations. So they offered a free testing clinic, and approximately 100 men, women, and children were provided free testing on the west end of Clallam County. Olympic Community of Health released COVID-19 response funds earlier this year to help mitigate some of the added challenges and address the unique needs across the region with COVID-19 response. Of all the funds that were distributed, 37% went to tribes within the region. So again, here I'd invite you to just pause and take a few minutes to brainstorm on your own. What are some other examples of where you see equity in action within your organization or within the region? For this next bit, I'm going to walk you through a little story that kind of helps illustrate one of the ways that we can think about moving equity into action. So this little stick figure here will pretend it's me. This is Miranda, and I'm going for a run along the Dungeness Spit here in Sequim, which is where my home is. Although lately, because of my growing belly and baby, this is becoming more of a waddle than a run. But anyways, I'm going for my weekly waddle along the spit, and I end up getting too close to the edge. Maybe the bluff moved since the last time I was there and I wasn't paying attention. and I end up falling over. And this hurts, obviously. Ouch. So what happens? The ambulance comes and takes me to the hospital. But think about this. What if there had been some sort of safety net to catch me before I hit the ground? So that would have maybe prevented the need for the ambulance to come and take me to the hospital. Or better yet, if we moved even further up in the storyline, what if there had been a fence there to prevent me from falling over the edge in the first place? Because let's face it, I'm probably, hopefully, not the only one who's ever gotten too close or ever will get too close to the edge. Or even better than the fence, maybe there are signs in education that are posted before you even get close to the edge so that people know to be cautious as they approach. So we can think of these as, in public health terms, you would think of these as looking upstream or downstream, or you might hear these also referred to as primary, secondary, and tertiary prevention. So way downstream, tertiary prevention really is responding to something that's already happened. So this would be, you know, the medical care that I receive as a result of what's already happened. So I fall, I hurt myself, and then I get this tertiary care. Very important, right? Because things happen and tertiary care is an important part of the system. When we move upstream a little bit, we start to look at secondary prevention. So these are like the safety net programs. So my example here included a literal safety net, but you might hear of safety net programs that are designed to kind of catch people as they are on their way to needing more serious assistance. And we could think of the fence here really as primary prevention. So we're moving up the stream, and these are primary preventatives that catch me before an incident has even happened or an event. And if we think about moving even further up the stream beyond primary prevention and thinking about what those signs and education materials would look like, that we could think about as addressing the determinants of health. So how does this concept relate to equity? Let's go ahead and look at two groups or two different communities. So we have the green group here and the orangish group here. So in one of the communities, maybe the ambulance is a little bit slower to respond. So you can see here my ambulance for the poor green group has lost its wheel. So they're a little bit slower to respond. So how might that play a factor in when we think about equity between these two groups of people? Or maybe in one of these communities there is no local ambulance, or the ambulance is very far away, so response times are really lagged and prolonged. And maybe in addition to that, there's no safety net or secondary prevention program that would, you know, catch these people as they are falling from the edge. And there's no fence or primary prevention either, so there's really nothing that kind of keeps these people from being cautious as they approach the edge and eventually needing some sort of intervention. So this, again, concept is often referred to as looking upstream or downstream. So I'll just play this short video that speaks about this concept much more intelligently than I can.
You're standing on the edge of a river. All of a sudden, a flailing, drowning child comes floating by. Without thinking, you dive in, grab the child, and swim to shore. Before you can recover, another child comes floating by. So you dive in and rescue her as well. Then another child drifts into sight, and another, and another. Eventually, hopefully, some wise person will ask, who keeps chucking these kids in the river? And they'll head upstream to find out. Every time we have to clean up an environmental disaster, every time a young person winds up in jail, every time people have to take medications to make up for the fact that they couldn't afford good food, we're suffering from the results of downstream thinking. Thinking upstream means making smarter decisions about what kind of country we want. What better goal could Canada have than creating the conditions for all people to enjoy true health and experience physical, mental, and social well-being. It's the best way to measure our success, and upstream thinking is the way we get there. Help us make the mainstream look upstream. Visit us at thinkupstream.net to find out more.
So I should have said before the video started that that this was a video from Canada. So, but hopefully the concepts still feel applicable and resonate. So I invite you to just kind of brainstorm on your own here. What does looking upstream mean in your individual organization? So whatever that looks like, maybe you're a community-based organization, maybe you're a healthcare organization or a behavioral health organization, and just kind of think about, what upstream means in your individual organization. Where do you see examples of that happening? And then once you have some examples from your own organization, think about your own community. So if you're, a resident of Clallam County, kind of think about your local local neighborhoods and local community and see, where do you see some upstream strategies happening? And then I'll invite you to think even more broader as you have those examples in your mind of where do you see upstream thinking within the region? What are some examples? And the region being, the 3 counties of Clallam, Jefferson, and Kitsap. So here I would invite you to maybe pull out a piece of paper and a pen and get ready to do some self-reflective activity. During the live presentation, people will be able to engage in some discussion, but as you're watching the recording, we're a little more limited to having these be more independent activities, but it might be helpful if you pull out a pen and paper and get yourself situated to work through some of these prompts. Where is the region doing well with equity work? So what are the strengths? And it can be helpful to kind of make a list. And then once you have that list of strengths, ask yourself, where are there gaps and what are the challenges in the Olympic region? And again, go ahead and make another list. And then the third list would be, what can we collectively as a region do better? What are the opportunities that exist? So maybe pause your video here and take, maybe 5 to 10 minutes on your own to brainstorm. And like I said, I'd really encourage you, if you have the ability to go ahead and write these prompts out. There's just something about actually physically taking the time and mental energy to write something on paper that can be a little more meaningful than just brainstorming in your head on your own. When you're ready, you can then kind of ask yourself, so what, now what? So, like what did you hear from yourself? What did you learn by writing this list down? So what does that mean? And now what? Now what are you going to do with that information? And ask yourself, what seems possible now? What do you feel inspired to do? What action steps would you like to see the region take? Your answers to these questions, we would invite you to send them our way. So och@olympic.ch.org would be a great place. Just send us an email of, what did you come up with in your list? What does that mean? What would you like to see happen? What action steps would you like to see the region take? Olympic Community of Health is really committed to continuing to move this work forward. Like I mentioned at the beginning, this is really just a starting place. And we would love to hear from you about what you would like to see next. So again, maybe on the back side of that piece of paper that you got out, I'd invite you to take maybe like 2 minutes and just on your own reflect, what commitments or next steps are you going to take? So as a result of today's learning, as a result of wanting to prioritize equity work a little bit more, maybe personally and or professionally, as a person, as yourself, what commitments or next steps are you committing to taking? And once you've brainstormed that list, and if I'm jumping ahead too quickly, feel free to pause the recording. Ask yourself, as a region, what commitments or next steps would you like to take? And again, I'd invite you to write these down on a piece of paper, but don't stop there. Type them up in an email and send them our way, or pick up the phone and give someone, some OCH staffer a call and let us know. What would you like to take as a region as a next step or as a commitment? So this reaches the end of our time together today. I want to thank you for tuning in and for lasting this long with the recording. I really have appreciated the opportunity to provide even an intro and sliver of information to you today. I hope that you're able to take away something new or renewed energy and commitment towards this important work. We really are looking forward to taking next steps together on our equity journey. Please send us your responses to those prompts. Your responses are really valuable to Olympic Community of Health and help us determine areas of interest and potential action steps moving forward. On the screen here is a list of applicable resources. So if you're interested in learning more, if one of your commitments that you made to yourself was to dig a little bit deeper and expand your own knowledge base, this is a start. This is obviously by no means a comprehensive list, but just some resources that OCH has pulled that are available to you if you're interested. So with that, I'll thank you for your time and for tuning in today, and we look forward to hearing from you. Thanks.